Ever since the discovery of penicillin, the world of medicine was forever changed. The thing which was then just an accidental discovery today is saving millions of lives all over the world. Yes, you heard that right. Penicillin, the first discovered antibiotic, was a chance discovery. It just happened that Fleming was working in his laboratory as usual, and he observed that in one of his petri dishes containing bacterial cultures, there was a mold around which these bacteria were unable to grow. This led to the discovery of penicillin, which even became the most widely used antibiotic during the World War II. From that time till now, many other antibiotics have been developed, and this has revolutionized the healthcare. But with their widespread usage, the antibiotics have brought a new challenge, which according to WHO is one of the biggest threats to global health. That is antibiotic resistance. Before we go on, let me introduce myself. My name is Adil Ahmed and I'm a second year MBBS student. I love creating videos where I share my experience, guidance, or simply make informative content like this one. So what exactly are antibiotics? Well, the name itself suggests that anti means against and biotics. Well, it sounds like life. Does that mean they are against our life? Well, not exactly. It actually means they are against bacterial life. See, antibiotics are actually the good guys in the fight against bacterial infections. They kill or inhibit the bacteria, helping our body's immune system to fight off the infection more effectively. So how do they do it? Well, the answer to this question is itself a big topic and beyond the scope of this video, but let me just tell you briefly. See, different antibiotics have different mechanisms. Some antibiotics may directly kill the bacteria by breaking down their cell wall, causing them to burst, while others may just interfere with crucial processes inside the bacteria and restrict their growth, so that our immune system can now easily handle those. Note that there are other mechanisms too, but as I said, those are beyond the scope of this video. Now till this point, everything was good and jolly. Patient comes with some bacterial infection, antibiotic is given, the bacteria dies and the patient is recovered. But the problem starts when the bacteria starts to get evolved, and now that particular antibiotic is of no use, at least to that patient for that particular infection. This is known as antibiotic resistance. Now let us understand how this happens and why should it concern you. You might have heard of Darwin's concept of survival of the fittest. He describes how nature selects those organisms which are better adapted to their environment, and those which fail to do so eventually gets eliminated over time. In the bacterial world, it's a similar story. When antibiotic is given, most of the bacteria are wiped out, but there are still some tough ones that stay, and if the antibiotic course is not completed, these tough ones may undergo mutations where they change some of their internal components to adapt with the situation and eventually get resistant to that particular antibiotic. Now these resistant bacteria may now multiply and pass their resistant traits to their offsprings. Now these superbugs are a serious threat. These can spread from person to person, within community, and even globally. This not only decreases the effectiveness of the antibiotic, but also makes the infection harder to treat. Remember the times of COVID when every now and then we got to hear the news that there was a new strain out there which made it more difficult to cure. Now that you know how these bacteria transform and give rise to this global threat of antibiotic resistance, let's find out why they happen in the first place. This will also help us understand what we can do in this situation. Although I just said in the previous section how every species wants to evolve and to survive and prevent themselves from destruction, and that this is just an evolutionary process, there are still many factors which directly or indirectly accelerate this process. Among these factors, overuse and misuse of antibiotic stand out prominently. Access to over-the-counter antibiotics, overprescription of antibiotics, or their inappropriate use in treating viral infections in which antibiotics are totally ineffective significantly fuels this problem. Moreover, the use of antibiotics in agriculture, particularly in animal husbandry, where these medications are often employed as growth promoters or for prophylactic measures rather than treatment, adds to the widespread presence of antibiotics in our environment. This continuous exposure of bacteria to antibiotics increases the likelihood of them developing resistance. Additionally, incomplete courses of antibiotics where patients stop taking the medication before completing the prescribed regimen create opportunities for the tougher bacteria to survive and potentially evolve to resistant strains. The combination of these factors contribute to the acceleration of antibiotic resistance, creating an immense challenge to deal with the bacterial infections effectively. Now, why should this concern you and me? See, when antibiotics become less effective or completely ineffective against certain bacterial infections, it leads to prolonged illness, increased hospital stays, and increased healthcare costs. Common infections that were once easily treatable can become life-threatening. Consider this scenario. A simple infection that could have been easily managed with a standard antibiotic now requires stronger, more potent medications or even multiple treatments. In severe cases, infections might not respond to any available antibiotics, leading to undesirable outcomes. Not only do these resistant bacteria affect individual patients, but they also pose a threat on a larger scale. These superbugs can spread within healthcare facilities or communities and even cross borders, making them a global concern. This compromises with the global health security and increases the risk of pandemics, making us more vulnerable to infections that were previously controllable. In agriculture, the use of antibiotics in animals leads to proliferation of resistant strains affecting food safety and the overall environment. The impacts aren't related to just healthcare. They touch every aspect of our lives, emphasizing the urgency of addressing antibiotic resistance as a global health priority. So what can we do now? For your information, to tackle the antimicrobial resistance as a whole, WHO has came up with a global action plan where they focus on 5 key objectives, which include improving awareness about AMR among the public, healthcare providers, and policymakers, strengthening surveillance and research efforts to monitor the spread and impact of AMR globally, preventing infections through vaccination, sanitation, and hygiene practices, optimizing antibiotic usage both in healthcare and agriculture, and lastly, investing in research and development for new antibiotics. This was WHO's global action plan, but as a common public, the main thing which we can readily do is to ensure we are taking antibiotics responsibly, only when it is required and prescribed by a doctor, and also don't forget to complete the full course. Also, within the healthcare sector, there's often a tendency of doctors to prescribe antibiotics as a precautionary measure, which might contribute to AMR. This shows how important it is even for doctors to carefully prescribe antibiotics and for everyone to use them wisely. There are still researches going on to tackle this global threat, one of which the use of combination therapies where multiple antibiotics are incorporated for patients who are at a risk of developing resistance. So antibiotics have been of a great importance in modern medicine, but their misuse and overuse is now leading to a significant threat. We can solve this problem only if we take collective measure and understand that every one of us have our own role to play. Remember, united we stand and divided we fall. With that said, do share this video with your friends and spread the word of awareness. It takes a lot of effort to make a video like this one, where apart from the editing, which itself a task, the content needs to be factually correct and properly researched. So thank you for watching. This was Adil Ahmad and I'll see you in the next one.